of these thoughts we have to ask. Then coming to the suicidal thoughts with method with specific plan, intent or plan. Some patients will have specific plan. Some patients will take veil also they will hang themselves. Some patients will take that saree also they will hang. That particular plan they will be having. So have you been thinking about how you might do this? Hence I will conclude. Hence I will to and then we have to ask the question. So if possible answers, if he say yes means from how many days you are getting and from how many weeks you are getting and in which month of day, in which day of month you are getting more thoughts like this. You have to ask. So suicidal intent without specific plan. Some patients will have no plan of suicide, but they will only tell us I want to die, I want to die. For like that person we have to ask, have you had these thoughts and had some intention on acting on them? ನೀವು ಇನ್ನೇನಾದರೂ ಟ್ರೈ ಮಾಡಿದ್ದೀರಾ ಸುಸೈಡ್ ಈ ಥರ ನೀವು ಸಾಯ್ಬೇಕಂತಿದ್ದೀರಾ ಈ ಥರ ಏನು ಟ್ರೈ ಮಾಡಿದ್ದೀರಾ ಅಂತ ನಾವು we have to ask. The possible answer will be yes or no from the patient. So coming to the fifth component, that is intent with plan. I have started to work out what the and then you from the patient will say 5 years in the Indian so you consider have you worked out any time you have attempted after an activity the detail how to kill yourself you will plan with your particular thing you will take the psychology so do you intend to carry this plan you have that plan whether you are intended you ಇಷ್ಟ ಮಾಡಬೇಕಂತ ಅನಿಸುತ್ತೀರಾ so positive answer will be from the patient is yes or if yes means whether he is a high risk situation then moderate risk means moderate risk situation. Coming to the suicidal behavior, some patients will show these behaviors like taking more sleeping tablets and like sleeping down. And some we have to ask, have you ever done anything, started to do anything, prepared to do anything to end your life? Have you prepared or have you started or have you did something to kill yourself? That's your class. For example, collected fees. Some before students before exam, some they will feel exam stress. In that time, some only students feels covered malconbittara hospital ಗೆ admit ಆಗ್ತಾರೆ. That is also one type of suicide attempt. So, obtain a gun and gave a valuable gift before suicide. Means 3 to 4 days he had planned to suicide means he will give his valuable things to his family members. Some he will write a will, his own all property he will write to the under his loved ones name and wrote a will of suicide note and took up this but did not follow any. Some patients will take some persons will take pills, more pills, but they will not swallow because they will have fear. If I try means what will be our family responsibility like that they will feel. Then held a gun but changed their mind and he was grabbed from the hand. One person is shooting his head by the gun, but some their family members and healthcare workers in their family they will take that gun. So when the root but did not jump or actually took pills. These are the some of the behaviors. He will go to the root layer, say that I will jump from here, from fifth floor, I will get injury. Like that he will tell but he will not jump. Try to shoot yourself or cut yourself, try to hang yourself. You have to ask these all questions to the patient and the possible answer may be yes or no. So if this psychotic disorders, schizoaffective disorders, schizophrenia, and alcohol and substance use disorders, people also more risk of getting suicide. And post-traumatic stress disorder. These patients will have some of the adverse life situations before they are coming to this situation. For that reason, they will have a higher risk. So, coming to traumatic brain injury and ADHD, here in these children or they grow adult also, they will have a impulsive behavior. Suddenly, decision ತಗೊಂಡ್ಬಿಡ್ತಾರೆ ಅಥವಾ more hyperactive ಇರ್ತಾರೆ, ಏನೋ legal accident plus cluster B personality are traits like antisocial behavior, antisocial behavior and borderline personality disorder, they have a higher risk of suicide. Family history, history of suicide, suicidal behavior, psychiatric diagnosis require hospitalization. So in our country, namdu haliyoಳಗೆ ಒಬ್ಬರು ತಾಯಿಯವರು with chronic illness they were suffering, but they are hanging themselves. That behavior only come to the her child, her daughter also. She is behaving like that. ಏನು ಸ್ವಲ್ಪ ಮನೆಯ ಜಗಳ ಅದನ್ನು ನಾನು ಹೋಗ್ಬಿಡ್ತೀನಿ, ನಾನು ನೇಣು ಹಾಕೊಂಡು ಸಾಕ್ಬಿಡ್ತೀನಿ So, history of suicide, suicidal behavior, psychiatric diagnosis require hospitalization. These are some of the factors. So, coming to the precipitant or stressors, triggering events lead to the humiliation, shame, or despair. So, loss of loved ones, exam failure, or unemployment. These are some of the triggering factors for the suicide risk. So, conduct problems, that is antisocial behavior and aggression and impulsive. As sir told, aggression is more correlated to the suicide attempt and impulsive. So, coming to the presenting symptoms, anhedonia, that suicide attempting people show no lack of interest in any work. They will not show any interest in work, and anxiety or fear. They will always in anxious mode. So I don't want to live, I want to die, like that in anxious mode they will. And impulsivity and insomnia, they are suffering from the sleep disturbance all time. And hopelessness and despair. Command hallucination. These are in schizophrenia patients, if they are suffering from command hallucination means if they got hallucination like that, you go and die there, you go and ನೀನು ಆ ಕಾಲಿಗೆ ಹೋಗಿ ಡಿಕ್ಕಿ ಹೊಡಿ, ಆ ಥರ ಹ್ಯಾಲುಸಿನೇಷನ್, ಕಮಾಂಡ್ ಹ್ಯಾಲುಸಿನೇಷನ್ ಬಂದರೆ there is high risk of getting suicide. So psychosis is the another presenting symptom of the suicide. Chronic physical pain or acute medical problem. And another example in our village, one person is suffering from the HIV, that is last stage. He will have more pain. He harm himself and he end up his life. So sexual or physical abuse. Some of the adolescents ಅಲ್ಲಿ ಏನೋ ಒಂದು ಅಟ್ಯಾಕ್ ಆಯಿತು. So they will have a more guilt feeling ಅವರಲ್ಲಿ ಕಾಡಿ ನಾನಿಂದು ಏನು ಉಂಟೋದಿಲ್ಲ ಅಂತ they will have a higher risk of getting suicide. Then homelessness and legal problems. Whether ಈಗ ಕೋರ್ಟಲ್ಲಿ ಯಾವುದೋ ಒಂದು ಇಶ್ಯೂ, ಪ್ರಾಪರ್ಟೀಸ್, ಅಣ್ಣ ನನಗೆ ಆಸ್ತಿ ಕೊಡಲಿಲ್ಲ, ನನಗೆ ಇವನು ಆಸ್ತಿನ ಕೊಡೋದಲ್ಲ, ಏನು ಮಾಡೋದಿಲ್ಲ, ಸರಿ ನಾನೇನು ಇಷ್ಟೇನು ಕೇಳಿದ್ರಿ, he will go to the hanging himself or poisoning himself, like that suicide attempts. And inadequate social support. So as religious ಇದ್ರೊಳಗೆ ನಿಮ್ಮ ರಿಲಿಜಿಯಸ್ ಆಗಿ ಕರೆಕ್ಟ್ ನಿಮ್ದ್ರೊಳಗಿದ್ರೆ ನಿಮ್ಗೆ ಏನೂ ಅನ್ಸಂಗಿಲ್ಲ, ಬಟ್ ಔಟ್ ಆಫ್ ದಿಸ್ ಇಫ್ ಯು ಆರ್ ನೀವು ಅದರಿಂದ ನಿಮ್ಮನ್ನ ದೂರ ಮಾಡಿದ್ರು, ಬಾಹಿರ ಹಾಕಿದ್ರು ಅಂತಂದರೆ ಅವಾಗ ದೇರ್ ಇಸ್ ಅ ಹೈಯರ್ ಚಾನ್ಸಸ್. Perceived burden on others and social isolation. So ಈಗ ಒಂದು ಅನಾಥ ಪೇಷಂಟ್, ಅನಾಥ ಪರ್ಸನ್ ಇರ್ತಾನೆ, ಅವ್ನು ಯಾರು ಫ್ಯಾಮಿಲಿ ಮೆಂಬರ್ಸ್ ಏನಿರಲ್ಲ, he will feel like a social isolation. Social society ಮೆಂಬರ್ ಆಗಿದ್ದಾಗ homelessness also he will feel. So coming to the change in treatment. Patient inpatient discharge. ಈಗ ತಾನೇ ಸುಸೈಡ್ ಈ ಥರ ಅಟೆಂಪ್ಟ್ ಮಾಡ್ಕೊಂತ ಪೇಷಂಟ್ ಅಡ್ಮಿಟ್ ಆಗಿ ಮತ್ತೆ ಡಿಸ್ಚಾರ್ಜ್ ಆಗಿದ್ದಾರೆ. ದೇರ್ ಆಸ್ ಅ ಹೈಯರ್ ರಿಸ್ಕ್ ಆಫ್ ಗೆಟಿಂಗ್ ಸುಸೈಡಲ್ ಥಾಟ್ಸ್. ಆ್ಯಂಡ್ ಚೇಂಜ್ ಇನ್ ಪ್ರೊವೈಡರ್ ಆಫ್ ಟ್ರೀಟ್ಮೆಂಟ್, ದಟ್ ಈಸ್ ಮೆಡಿಕೇಶನ್ ಚೇಂಜ್ ಮಾಡಿದ್ರು, ಸೈಕೋಥೆರಪಿಸ್ ಅಂತ ಏನೋ ಚೇಂಜ್ ಮಾಡಿದ್ರು. ಸೊ ಹೋಪ್ಲೆಸ್ನೆಸ್ ಆ್ಯಂಡ್ ಡಿಸ್ಸ್ಯಾಟಿಸ್ಫೈಡ್ ಪ್ರೊವೈಡರ್ ಆ್ಯಂಡ್ ಟ್ರೀಟ್ಮೆಂಟ್, ಆ್ಯಂಡ್ ನಾನ್ ಕಾಂಪ್ಲೇಂಟ್ ಆ್ಯಂಡ್ ನಾನ್ ರಿಸೀವ್ ಹಾಳು ಮಾಡ್ತಿದ್ದಂತ ಅವ್ರಿಗೆ ಗೊತ್ತಿದ್ರು ದೇ ವಿಲ್ ಗೋ ಟು ದಟ್ ಆಕ್ಟಿವಿಟಿ ಲೈಕ್ ಕಾರ್ ಆಕ್ಸಿಡೆಂಟ್ ಕಾರ್ ಫಾಸ್ಟಾಗಿ ಬರ್ಬೇಕಂತ ಗೊತ್ತಿದ್ರು ದೇ ವಿಲ್ ಗೋ ಟು ದಟ್ ಕಾರ್ ಬೈ crossing the road. Then these are the first step one. Coming to the step two, identifying the protective factors, that is internal and external factors. In that, ability to cope with stress, whether he has a good coping, adaptive coping strategies, he will have a protective, he will protect from the suicide. And frustration tolerance, how he will ಅಂದರೆ ಎಷ್ಟು ಚೆನ್ನಾಗಿ ಸ್ಟ್ರೆಸ್ನ ತಡ್ಕೋತಾರೆ, ದಟ್ ಈಸ್ ಫ್ರಸ್ಟ್ರೇಷನ್ ಟಾಲರೆನ್ಸ್. ಆ್ಯಂಡ್ ರಿಲೀಜಿಯಸ್ ಬಿಲೀಫ್ಸ್, ಅಂದರೆ ಒಂದಿಷ್ಟು ಜನ ನಂಬ್ತಾರೆ, ಸೊ ನಾನು ಹಿಂಗೆ ಸುಸೈಡ್ ಮಾಡ್ಕೊಂತ ಸತ್ತಾರೆ ನನಗೆ ಮುಕ್ತಿನೇ ಸಿಗೋದಿಲ್ಲ ಅನ್ನೋದ್ರಿಂದ. ಸೊ ದಟ್ ಈಸ್ ಒನ್ ಆಫ್ ದ ಟೈಪ್ ಆಫ್ ಬಿಲೀಫ್ಸ್. ಆ್ಯಂಡ್ ಫಿಯರ್ ಆಫ್ ಡೆತ್ ಆ್ಯಂಡ್ ಆ್ಯಕ್ಟ್ ಆಫ್ ಕಿಲಿಂಗ್ ಹಿಮ್ಸೆಲ್ಫ್ ಆ್ಯಂಡ್ ಐಡೆಂಟಿಫೈ ರೀಸನ್ಸ್ ಫಾರ್ ಲಿವಿಂಗ್. ಆ್ಯಸ್ ಸರ್ ಟೋಲ್ಡ್, ಇಫ್ ಒನ್ ಚೈಲ್ಡ್ ಈಸ್ ದೇರ್ ಮೀನ್ಸ್ ಓ ಈ ಮಗುವಾದರೂ ನಾನು ಬದುಕಬೇಕು. Like that, she will bring our percentage fee. External factors, that is cultural, spiritual and moral activities against suicide and responsibility to the children. These are some of the protective factors. Beloved pets and support the social network of family and friends. Positive therapeutic relationship and engage in work or school. Whether he is engaging other active, well, the other one activity now involved together, he will not get in that parts. Then coming to the suicidal inquiry. Inquiry asks specific questions about suicidal thoughts, plans, intent. Repeat the step 1 to 5. Step 1 1 to 5 components are other steps. Then coming to the suicidal ideation intensity. Most severe ideation is 1 to 5. Identify about it. Step 1. Frequency. How many times you are getting these thoughts? To ask the patient that how many times you are getting these thoughts in a month. In 1 month, how many times you are getting? The possible answer may be less than 1 week. We will tell that. If 1 month just started, I go once a week, only 1 week, no, 1 answer after 1 week. So 4 to 5 times a week, it is a higher risk. And daily or almost daily, it is most higher risk than, and many times each week. Then coming to the duration, that is frequency, how many times they are getting, and this is duration. From how much back they are getting these thoughts. When you have a thoughts and how long they last. Means ಈ ವಿಚಾರ ನೀವು ಎಷ್ಟು ವರ್ಷದಿಂದ ಸ್ಟಾರ್ಟ್ ಆಗೋದು, ಎಷ್ಟು ನಿಮಿಷ ಇರ್ತಾವ ಅಥವಾ ಎಷ್ಟು ತಾಸು ಇರ್ತಾವ. In that possible answer may be few seconds or minutes or less than 1 hour or some of the time, 1 to 4 hours of large time or 4 to 8 hours most of the day. Almost they are very attempt ಅದೇ ವಿಚಾರದಲ್ಲೇ ಇರ್ತಾರೆ ಪೇಷಂಟ್. That's why ಅವರು 24 hour vigilance ಇರುತ್ತೆ. More than 8 hours are persist. Then coming to the controllability. Would you stop thinking about killing yourself or wanting to die if you want? ನೀವು ನಿಮ್ಮ ವಿಚಾರನ ನೀವು ಕಂಟ್ರೋಲ್ ಮಾಡ್ಕೋಬೋದಾ? ಸೊ ನಾವು ಯು ಆರ್ ಗೆಟಿಂಗ್ ಸುಸೈಡಲ್ ಥಾಟ್, ನೀವು ಈಗ ಏನೋ ಒಂದು ಹ್ಯಾಂಗಿಂಗ್ ಹೋಗ್ತಿದ್ರು, ಬಟ್ ಯು ಕ್ಯಾನ್ ಕಂಟ್ರೋಲ್ ದಟ್, ನೀವು ಕಂಟ್ರೋಲ್ ಮಾಡ್ಕೋಬೋದಾ? ಆ ಥರ ನಾವು ವಿ ಹ್ಯಾವ್ ಟು ಆಸ್ಕ್ ಫಾರ್ ದ ಪೇಷಂಟ್ ಇನ್ ಅ ಕಂಟ್ರೋಲ್ ಆಫರ್. ದ ಪಾಸಿಬಲ್ ಆನ್ಸರ್ ಮೇ ಬಿ ಡಸಂಟ್ ಅಟೆಂಪ್ಟ್ ಟು ಕಂಟ್ರೋಲ್ ಥಾಟ್ಸ್. ಅವರು ಬೇರೆ ಏನು ವಿಚಾರ ಮಾಡಿದ್ರು ಸುಸೈಡ್, ಬರೀ ಸಾಯೋದಕ್ಕೆ ವಿಚಾರ. ಸೊ easily able to control thoughts. Some of the person will have, I can control my thoughts because I remembered my children, I remembered my family members, so I can control my thoughts. I will divert it from that suicidal thought. That's it. And can control thoughts with little difficulty, and can control thoughts with some difficulty. So for can control thoughts with a lot of difficulty. Some patients will can't only control their suicidal thoughts, unable to control thoughts. That is a factor. Then coming to the deterrents, that is stopping agents. Who will stop? Are there things or anyone or anything that stop you from wanting to die or acting on thoughts of suicide? Whether if you are going to kill yourself means whether some of the stopping agents are there. If you stop yourself from killing, For example, family, whether family, religion, pain of death. These are the factors which have stopped you from the killing yourself like that you have lost. The possible answer will be doesn't apply. If they will not tell means it doesn't apply. And deterrence definitely stop you from your attempting suicide. Like family members. On that time they remember their family members. So that deterrence stop their from attempting suicide. And deterrence probably stop you. And uncertain the deterrence stop you. And deterrence most likely did stop you. If one person because of the family problem only he is going to kill himself at that. Otherwise what agala. That deterrence most likely did stop you. And deterrence definitely did stop. Like one the deterrence pain of death. Avanu cancer but he is not controlling his pain. That is one of the deterrents, but that did stop him from this killing himself. So reasons for ideation, that is what sorts of reasons did you have for thinking about wanting to die or killing yourself? Was it aimed to pain or stop the way you are feeling, or was it to get attention, revenge, or reaction from others? Some people will act like I will go to suicide like that because to get the attention from others. So and some people will act to get suicide. They will feel alone or they will feel a pain. In that reasons we have to ask whether you are what are the reasons you are going to kill yourself. So possible answer will be doesn't apply. First one is they will have no any reasons to and completely to get attention, revenge or reaction from others. So ಈಗ ಯಾರೋ ನನಗೆ ಏನೋ ಅಂದಿದ್ದಾರೆ ಅವ್ರ ಜೊತೆ ನಾನು ರಿವೆಂಜ್ ತಗೋಬೇಕಾದ್ರೆ ನನಗೆ ತಗೊಳಕ್ಕಾಗ್ತಿಲ್ಲ ಸೊ ಐ ವಿಲ್ ಡೈ ದಟ್ ಈಸ್ ಒನ್ ಆಫ್ ದ ಫ್ಯಾಕ್ಟರ್ ಆ್ಯಂಡ್ ಮೋಸ್ಟ್ ಟು ಗೆಟ್ ಅಟೆನ್ಷನ್ ರಿವೆಂಜ್ ಅಂಡ್ ರಿಯಾಕ್ಷನ್ ಫ್ರಮ್ ಅದರ್ಸ್ ಈಕ್ವಲಿ ಟು ಗೆಟ್ ಅಟೆನ್ಷನ್ ರಿವೆಂಜ್ ಆ್ಯಂಡ್ ರಿಯಾಕ್ಷನ್ ಫ್ರಮ್ ಅದರ್ಸ್ mostly to end or stop the pain. If the person is suffering from severe pain, ಅಂದ್ರೆ in accident ಅವರೇನೋ ಕೈ ಕಾಲು ಪೂರ ಕಳ್ಕೊಂಡಿದ್ದಾರೆ. So I am burdened to my family or my caregivers. So I will die. This is the most painful for me. I can't live with this pain. You can't completely to end or stop the pain. That is the fifth. So coming to the interventions, that is the first one we have to assess the level of the risk level, that is high, moderate and low risk. According to the risk only we have to give intervention. That we take part in 4 sessions. In the high suicidal risk, that suicidal ideation with intent or intent with plan in past month. High suicidal risk means in past month also he had attempted, presently also he is attempting the suicide acts. And suicidal behavior within past 3 months also we are considering as a high risk suicidal patient. So possible interventions may be if we find that like in past 3 months he has attempted means the immediate psychiatric hospitalization is required for that patient. So stay with patient until transfer to the higher level of care is complete, and after that care that follow-up is needed for the high risk patients. Coming to the moderate risk. Here in the first, that is suicidal intent or plan with the past 1 month and past 3 months. Here in this suicidal ideation with method but without plan. Here he will not plan, only he know the method, in what method I have to die, but he didn't make any plan. So and intent or behavior in the past month. Suicidal behavior more than 3 months ago. Past 3 months he had not attempted any suicide, but he is expressing that I want to die or I want to die like this. Like this he is expressing, means that is moderate risk level. So here multiple risk factors will be there and few protective factors will be there. The possible interventions may be directly address to the suicide risk and implement showing any suicidal behavior. And modifiable risk factors and strong protective factors. No reported history of suicidal ideation or behavior in the low risk. And the possible intervention may be outpatient referral services. On OPD basis, they can be treated. So coming to the documentation, first we have to assess the risk level, whether it is in the low risk, medium risk or high risk. We have to document which risk we are. And after that, we have to assess about the warning signs of suicide. And if we go to the washroom 5 minutes, we have to see him, whether he is coming or what he is doing in that washroom. We have to tell the family caregivers to assist him with the washroom. That the warning and risk indications, protective factors. What are the protective factors he is facing while attempting suicide? That also we have to document and assess the lethal means and specific assessment data to support risk determination. Specific assessment means if the patient is suffering with the physiological disorders, that is HIV or any carcinoma, like that disorder means separate assessment will be needed for. And coming to the rationale for action taken or not taken, whether he took any action for attention or any not taken any action means we have to document in the